When you are talking to patients, how do you explain stroke to them?
So I think it's good to speak in layman's terms. Not everybody is privy to medical terminology. So you have to look at stroke. You have to look at your brain as a busy city, and that busy city having a constant, steady flow of electricity. Well, the way that electricity gets delivered to the city is by these major power lines, okay, AKA the arteries that carry blood from your heart to your brain. Now, sometimes there's a disruption in that communication from the source of power to the city, and you get a blackout. That is typically a stroke. That's typically how a stroke would manifest. There's a temporary disruption in that flow of blood, which causes those cells in the brain to die, in essence. And we manifest that in different and various ways. It could be slurred speech, it could be unilateral weakness, it could be headache, it could be disruption in vision, things of that nature. So I kind of relate it to a city that has a power outage. Now, sometimes we can restore that power and things are running as they should. Other times we can't. And that's where it gets a little complicated.
He's exactly right. And when you think about stroke, one of the things that he mentioned is he mentioned all the types of symptoms that you can have. The reason that you have many different types of symptoms when we're talking about stroke is because as a result of your heart pumping blood up to the brain, right? And there's several different pipes that the blood can go through to basically service different parts of the brain. Your brain, this big organ up here, has a heavy responsibility and controls many things in your body. So it controls the way you move your arms, the way you move your legs. It controls your heartbeat. It controls your swallowing mechanism. It controls your vision, where you see, what side of the brain is seeing what, all of these things. And so based upon where that lack of blood flow is, you're going to have different symptoms, right?
Correct.
There are major arteries that go up to the brain, and we all know the names of them, right? We all know the anterior cerebral artery, the posterior cerebral artery,
Hmm.
the communicating artery,
Hmm.
right? The vertebral artery. All of these arteries are, like you said, they're just power lines going to different parts of the brain
Yep.
and the brain stem.
Correct. Yeah, and the vertebral arteries supply blood to the posterior aspect of the brain, while the carotid arteries supply blood to the anterior portion of the brain. And then you have what's called, a lot of people know from anatomy, circle of Willis. Those two are able to communicate and keep a constant supply of blood to the tissue of the brain. And so sometimes there's a disruption in that, but you have other mechanisms in place to sometimes supply blood to the area that has a lack, a deficiency in that blood supply.
And because your cells in your brain are always working, if they do not get blood flow for seconds, they immediately start
Highly
dying.
responsive to that deficiency in blood flow.